Hello, my name is Polly. I'm one of the medical students. Can I confirm your name and date of birth?
Yes, it's Kitty Simpson, 29th of March 1985.
Nice to meet you, Kitty. Today I've been asked to perform an examination of your pregnant abdomen. This will involve me having a look at your tummy, feeling your tummy and baby's position, also taking some measurements and listening into your baby's heartbeat. Is that okay?
Yes.
Do you have any pain today?
No.
You shouldn't have any pain on the examination, but some people can find it slightly uncomfortable. If at any point you find it too uncomfortable or you have any pain, let me know.
Okay.
Would you like to empty your bladder before we begin?
I'm okay, thank you.
Have you got any questions?
No.
Are you comfortable?
Yes.
To start with, I'm just going to have a look at your hands and feel your pulse.
Okay.
Now I just need you to expose your tummy for me, please.
Okay.
And that's the end of the examination. I'll cover you up, okay?
Thank you.
Today I examined Kitty, a 34-year-old woman. She's a para 0 at 39 weeks and 4 days in her first pregnancy. On inspection, the abdomen was gravid, appropriate for dates, and she had linear nigra visible. On palpation, the abdomen was soft and non-tender. The singleton fetus was longitudinal lie and cephalic presentation, and the head was engaged. To complete my examination, I would like to perform a blood pressure and urinalysis.